So a couple of days ago, I received the news that I have prostate cancer, which obviously has come as a bit of a shock. I had no symptoms that would indicate that I'm sick. And it's come about as a result of just having regular blood tests with my GP because I have a family history of it. But as a 49-year-old, I obviously wasn't expecting to get any kind of cancer this young in my life.
Yeah, look, 49 years old, healthy, enjoy sport, enjoy cycling, enjoying life. You don't think that this is going to happen to you. Since I was about 40, I was having regular sort of GP checkups for health and stuff, regular blood tests for the hereditary diseases my family have, which in my case, unfortunately, there's not that many. We have no history of really bad disease. The only things that we would really check for is diabetes, which my father's side has, and then on my mother's side there's prostate cancer.
Hi Darren, morning. Come in, take a seat.
Darren presented to his GP who performed a prostate blood test, particularly based on the fact that Darren had some family history of prostate cancer. This came back elevated, but in Darren's case, we had to take into the context that he did a lot of cycling. So sometimes when patients do a lot of cycling and they spend time on a hard saddle, it can push their PSA up a bit, and that could give a falsely elevated PSA. So in Darren's case, we repeated his PSA again after a couple of months, and we made sure that he did not cycle for at least 6 weeks.
Just a short to the undo stand, please.
And when the PSA test was done the second time around, it was actually higher. So that rang alarm bells.
Gently pop a finger in.
Darren's prostate exam was normal, but because his PSA had risen,
All right.
I sent him for an MRI scan.
All done. And you can see here that the first lesion's at the left base.
He had 2 lesions in his prostate that were approximately 5 millimeters in size, and then we did an MRI fusion guided prostate biopsy where we did a 3D reconstruction of his prostate using the MRI.
Target these lesions here.
And then superimpose that onto his real-time ultrasound image of the prostate. We biopsied those lesions as well as the rest of the prostate.
That's good. All right. So let's do right apex now.
And in Darren's particular case, he had 1 out of the 36 samples that were taken that came positive for gleasonate high-grade prostate cancer.
And so the first targeted lesion at the base, you know, the one that I showed you on the MRI scan, that was the only one that came back positive.
It was bad news in the sense that Darren was diagnosed with prostate cancer, but it was also very lucky that we had this equipment available, that we were able to diagnose him, because I believe we've diagnosed him at an early stage where it has not progressed.
So what that means is that we would recommend active treatment for this because it is a clinically significant prostate cancer. It's called a Gleason 8 prostate cancer, and that puts you in a high-risk category.
There's definitely a male propensity to man up and just deal with stuff. I am actually an emotional person. I'll cry at a movie, you know, like that's fine. But when it comes to my own self, I guess I am a little bit stoic.
When you actually look at what I was talking about, which is the smaller lesions, we believe that doing it this way is more accurate.
Yeah. Okay.
You mention a high-grade cancer or even cancer, and I guess, you know, in my mind, the way it works is that it goes to worst-case scenario straight away. And even though I have knowledge about, you know, my uncle's got, you know, prostate cancer too, and so he's been having treatment for a while, and I've been talking to my auntie about that. So I have knowledge about prostate cancer. I know that it is very treatable. It still went to, oh my goodness, you know, could I lose my husband?
Okay. So we don't know for sure at this stage whether it's confined to the prostate.
The next steps would be to organise a staging scan, which is a PSMA PET scan. That's what we'd recommend.
After the prostate biopsy was done and we got the diagnosis of a Gleason 8 prostate cancer, we organised a PSMA PET scan for Darren, and we're quite fortunate in this country that we can offer this, because there's not many countries in the world that offer it apart from here, and I believe in Germany, and that's a highly sensitive staging scan which picks up any prostate cancer cells outside of the prostate. Thankfully, in Darren's case, his prostate cancer was confined to the prostate alone.